All right. And so we just did your second session in the series of 6.
Mm-hmm.
And so tell me a little bit about why you were interested in lymph, or what caught your attention about it in the first place.
Yeah, what caught my attention in the first place, I had a hip surgery in 2025 that reconstructed my whole hip. And really, as soon as I had that done, it was like I just accumulated so much inflammation, so much pain, so much fluid. And I honestly didn't know what to do about it. I went on Whole30, I did like all these things. And honestly, I must have been talking about it or something to myself or someone, I don't know, but you popped up on my Instagram, and it was like someone answered the universe answered my prayers, because I had been able to, really get this fluid out of me and feel like, I'm going to have my legs back, and I'm going to have, no pain. Like, I don't know what it feels like to not have pain in my whole body. So I'm excited to be able to say I'm at least a 2 out of 10, or just to be able to wear shorts and feel confident.
Mm-hmm. When you say you would be happy with even a 2 out of 10, what is that pain level usually like for you?
When it's bad, it's like an 8, 9 out of 10. So just to feel like, oh, I feel kind of something, like, is a huge win for me. Because I played sports my whole life, so I had a lot of pain usually. But after this surgery, it was just my whole body from my waist down just was like an 8 out of 10 all the time.
Okay. And you said that surgery was about 5 years ago?
Yep, March of 2020.
And did you get any lymph? Did they tell you anything about it?
No, they didn't tell me anything. They just had me go through like physical therapy, and that was it. And there was no like massaging, no nothing. So I was like, what do I do about this? So I did get a massage therapist and did that for a while, but it wasn't lymph related. Like, it was just a deep tissue massage, which helped with some of my pain, but it wasn't really getting to the root, of the issue.
Did you feel like you were mostly just chasing symptoms versus getting ahead with those deep tissue massages?
Yeah, absolutely.
And then what did you notice when you tried the Whole30? Did that get you some results?
I mean, a little bit, but it, like, my legs didn't change, like nothing that was like super big in inflammation really changed. Like, maybe I was less bloated, things like that, but the stuff where I'm like, I told you that I really want to change, like, it's nothing is, worked for that, and Whole30 didn't.
And you drained really well today. I'm excited to see what happens in your next few sessions.
Yeah.
But you had mentioned when we were working today that you wish that your surgeon or somebody had told you, because had you done, not necessarily the standard lymph, that takes a lot more sessions. It's not as effective as what we do in here. But even clients who get 1 session before any kind of a surgery, and then 1 to 3 sessions minimum at the end of a surgery, heal like 95% faster. And you were saying that you wish that you had known, because had you done something like this 5 years ago to prep and recover from the actual surgery, you might not be in this level of pain and feeling like you have to start from kind of a rock bottom situation and climb your way out, when it would have been much easier to prevent at the time.
Yeah, absolutely. Like, I mean, I tried everything you could think of. Like, I got myself a horse trough and did ice baths, at the cold of the winter, and did the massages, did the PT, I did everything I could think of, ate well, all of it, and it just didn't do anything really. It just always came back.
And you mentioned that you have a brother who is getting ready for surgery, and you were asking him, what did they tell you to do? And you were telling him some stuff for his lymph.
Yeah. Like they literally just said, make sure to, not eat 24 hours before, and then afterwards do your PT. And there was nothing else, like nothing with his nervous system, nothing with his lymph system. And I'm like, what the heck? Like, I don't want him, I mean, his surgery wasn't as bad, but I don't want him to be in my position in any form. So yeah.
Yeah, well, I love that you're sharing the word and spreading the tips, because it does make a big difference.
Yeah, absolutely.
Well, thank you so much. I'm so excited to see what happens in
Yeah.
the next couple of weeks for you.
Yeah, no, I appreciate you. I'm excited too.
Thank you.